Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. This is COVID-19 Pandemic World News, May 2021. Vaccinated people are dying from COVID-19 infection. Let us take a deeper look into this, find out what is causing these deaths and how we can protect ourselves. So let us begin. Welcome to Texas. I am from Houston, Texas, and we are going to go to Dallas, Texas, where Dallas Fort Worth NBC reported on 4 fully vaccinated COVID-19 patients who developed COVID-19, who also had high-risk health conditions, died from COVID-19 in the Dallas County. CDC, as of April 26, reports more than 9,245 cases of COVID-19 infection among those who have been vaccinated. Let me underscore, more than 95 million people have received vaccine as of that date. The incidence of COVID infection in people who have received vaccine is 0.009% versus 10% in the general population. So let us keep that in mind. It is not that the vaccines are not working. We have to understand the limitations of the vaccines, the environmental conditions, and people's habits. Houston recently reported on 4 cases of COVID-19 infection with a variant from India which has triple mutation. Houston is not the only state. In fact, California, several of my friends have communicated to me through private chats that people who had been fully vaccinated here in the United States, who went to see their relatives and family members in India, got infected with COVID-19. In fact, there is a well-known case of an infectious disease expert who was fully vaccinated here in the United States, went to see his father, came down with COVID-19, and after 3 to 4 days died from COVID-19 infection. It is possible for people who have been fully vaccinated to still get COVID infection. If you understand the vaccines and how vaccines work, you will have a better understanding and appreciation of what is happening today in the world pandemic of COVID-19. Even the best vaccine, like measles vaccine, is only 95% effective. If you were to take Pfizer or Moderna vaccine, they are also only 95% effective. That means 5% of the people can still get infected with the coronavirus infection. How can these people get infected with the COVID-19 after they had vaccination? As I said, vaccines are only 95% effective. Even in the studies, 5% of the people had a breakthrough COVID infection. Number 2, the test that we use to detect coronavirus detects the live virus, the virus remnants, and virus particles. So it is not an accurate test to detect who is actually infected with the COVID-19 and who is capable of spreading the COVID-19 infection. On top of that, if you add the coronavirus variants, it makes the story much more complex and intriguing. If you are talking about a person with multiple risk factors like heart disease, diabetes, hypertension, kidney failure, all these things compound together, which makes one vulnerable for COVID-19 infection, especially if you are facing a coronavirus variant. Now, here's an interesting observation which was just passed on to by my friend Dr. Vadera, and he said 25% of the new cases detected have been found in children. Now think about it. And this has been attributed to the fact that the parents are vaccinated. They feel comfortable that they are very well protected, at least up to 95%. So they are taking this occasion to go to the parks, vacations, travel, and they are taking children with them. But their children are not vaccinated. And now we are seeing a spike in the number of younger children getting infected with the coronavirus as they go on vacation. So thinking about a summer vacation plan, think about your children, their safety. As I said, the coronavirus vaccines were tested on the first variant of the coronavirus. But since these vaccines were tested and approved, at least for emergency use, we have the UK variant, we have the South African variant, we have the Brazilian variant, we have the triple mutation from India, and there are other new variants detected on a weekly basis. And remember, none of the vaccines have been specifically tested against any one of these variants. In fact, Johnson & Johnson, which was studied here in the United States and Africa, is the one that has been shown to be 60% effective against these South African variant. Now the question is, we are all fully vaccinated. We feel a little bit confident. But what do we do? How do we protect the entire family, especially the teenagers and the children who have not been vaccinated? While talking about children, in fact, the FDA just approved Pfizer and Moderna's vaccine to be used in children between 12 and 16. So that is a step forward. But remember, there is a small chance, about 5% according to the studies, who could still get coronavirus infection in spite of being vaccinated. You need to continue to use the mask to prevent the exposure to the coronavirus or its new variants. I would suggest still to avoid crowded places so you don't get an overdose of the coronavirus. Prevention is the best treatment. When it comes to prevention, only you can do it better than any government mandate can. So ladies and gentlemen, you have been watching COVID-19 Pandemic World News Update, May 2021, focusing on breakthrough COVID infections and mortality among those who have been fully vaccinated. Think about your children when you plan for the vacation in the coming summer. And please do subscribe to our YouTube channel. We will see you next time.